Hello, I'm Helena and I'm a senior analyst in the global strategy team at PHTI Evidence. And today I'll be talking through one of the posters I've contributed to for the upcoming ISPOR conference. Peterson Health Technology Institute, or PHTI, is a relatively new key stakeholder within the digital healthcare landscape in the US. The organisation was established in 2023 and since then has been leading the conversation about evidence standards for new digital health innovations and whether they represent value for money for payers. The reports and activities of the PHTI have generated a lot of engagement and are often publicised and commented on across many high-profile channels. So my poster sought to quantify the impact that the PHTI's reports have had and whether this might be having a tangible impact on payer decision-making about digital health technologies in the US and what this might mean for digital health technology manufacturers. With this in mind, the three objectives for the research were to quantify how the PHTI's reach has accelerated between when it was established in 2023 and December 2024. I then wanted to investigate who was talking about the PHTI, which audiences were viewing and commenting on their work, what the sentiment of the communications about the PHTI are, all of this to infer how the PHTI's publications are being perceived by key audiences and decision makers. I also looked at whether the PHTI's reports were cited in the academic literature, particularly to see whether digital health technology manufacturers are considering the PHTI's framework in their published clinical studies. To do this, I conducted a targeted search on Google and Google Scholar, searching for the PHTI and exporting all results. The search results were then reviewed and analysed, looking quantitatively at the number of mentions and qualitatively coding and categorising the aspects of interest. For the Google Scholar results, I looked at what types of journals were reporting on the PHTI, what types of study they were, as well as the impact factor of each of the journals. So in terms of the results, as you can see, the number of mentions of the PHTI increased fairly linearly over time and is likely to continue on a similar trajectory as the PHTI regularly published high-profile and high-impact reports. In terms of the authors and the channels that commented on or reported on the PHTI, these were mainly split into two key channels, the first being trade news publications that specialise in digital healthcare markets, and some of these were very high-profile outlets, which comprised of around 2/3 of the total mentions. The other third was a variety of blogs, and you can see the range of blog authors, which highlights the super broad range of stakeholder groups that are interested in the PHTI's work. So this spanned from trade bodies, medical associations, manufacturers themselves, overall again highlighting the very broad range of groups who are interested in and may be impacted by the PHTI's work. I also looked at the target audience of each of the channels noted in the previous figure. As you can see, the primary audience is healthcare managers and decision makers, showing that the PHTI's reports are indeed reaching the right people, this being payers and decision makers who decide whether or not to fund the digital health technology. The other audiences exposed to the PHTI's reports spanned investors, clinicians, patients, academics, policymakers, again showcasing the very, very broad reach of the PHTI's initiatives. I then looked at the sentiment of each of the pieces of coverage and tried to infer how the outlet was perceiving the PHTI's information. The majority was simply neutral and just stated the facts of the report. 30% of the pieces of coverage were positive and described the importance of the PHTI's work and how it is much needed. 13% of the results were either critical or gave a bit more of a nuanced perspective, which highlighted the strengths of the PHTI's work and the importance of setting evidence generation standards, but also acknowledged the possible limitations of their methods and how it could make the landscape more challenging for manufacturers. I then found 17 published studies where the PHTI's reports were cited in the academic literature, Some of these citations were across very high impact journals, which highlights that the PHTI's reports are seen as having an academic rigor and may suggest that the PHTI is seen as a methodological innovator and are really contributing to the broader knowledge base about digital health technologies. There were also a couple of examples of clinical studies where the PHTI's reports had been cited, showing that the organisation's reports are having the desired impact on shaping manufacturers' evidence generation plans for their new technologies. To summarise, it was really interesting to see simply how much impact the PHTI's reports have had, even within just a year and a half of the organisation being established. Especially seeing the reports being cited in such high impact journals shows that the organisation is really having an impact and will continue to significantly contribute to the field. I suppose the takeaways from the research for digital health technology manufacturers are that although it cannot concretely be concluded whether payers are actively using the PHTI's reports to inform their coverage decisions, our research shows that manufacturers should be paying attention to the work the PHTI is doing, as their work is definitely reaching the right people. At Petari Evidence, we regularly work with digital health and medtech manufacturers across the globe to advise on their market access strategies and help them navigate complex reimbursement landscapes. Conducting this research has really been eye-opening into how the landscape for digital health technologies is shifting as payers want more certainty on the clinical benefit and value for money of new digital innovations. And we look forward to continuing to advise and support our clients to get their innovations to patients. Thank you very much for listening.